The purpose of this project was to determine the feasibility of using provider-led participatory visual methods to scrutinize 4 hospital units' infection prevention control practices. Quality improvement initiatives to improve infection prevention control are essential for decreasing healthcare-associated infections. These infections are one of the most frequent and severe complications of hospitalization and are the 4th leading cause of in-hospital deaths. Although research to date supports the use of multiple interventions, such as education, surveillance, and environmental measures to prevent and control infections, little is known about the adoption of these interventions. To address this patient safety issue, one promising approach is to examine the social and environmental perspectives. Based on this, a qualitative study using participatory visual methods was used to design and implement an infection prevention and control quality improvement intervention. These methods consisted of provider-led photo walkabouts of the units and photo elicitation sessions, which included clinical and non-clinical team members. The initiative was conducted at a hospital in Ottawa, Canada. 4 inpatient units were selected on the basis of their interest to participate and on their higher incident rate of Clostridium difficile infection. Following the walkabout, a collective review of the photographs took place on each unit. At the session, the photographer and the infection control professional facilitated a discussion to elicit staff's overall recommendation on the infection prevention control improvements and their feedback on the participatory visual methods. To ensure the feasibility of this intervention, a primary goal was to implement the recommended infection prevention control improvements in the most cost-neutral way possible. A secondary walkabout took place to document the changes made. Following this, there were common themes on all the participating units, including insufficient storage space and the absence of clear processes for removal of unnecessary or damaged equipment and of meal trays from contact precaution rooms. Participants agreed that these visual methods were an effective way to promote discussion and cultivate shared responsibility among the staff. In conclusion, the participatory visual methods were implemented to facilitate change and encourage staff involvement in infection prevention control practices. Future plans include the implementation of these methods on other units and the ongoing quarterly walkabouts to monitor success and sustainability. Overall, this initiative confirmed the feasibility of implementing these methods more broadly as an effective strategy.